11.
It's heart-wrenching because these people are normal human beings like you and I.
Tonight, the growing heroin epidemic took center stage in North Buffalo. This deadly trend has been making headlines for months now, with countless stories of abuse occurring across western New York.
But tonight, 7 Eyewitness News reporter Hannah Buehler is speaking to those in charge and those who know this issue firsthand on how they actually plan to stop it.
Your whole day revolves around getting an opiate, trying to feel better. You get sick if you're not taking them, and you become desperate.
Jessica Emke knows what it's like to chase that high. Her addiction took her down the dangerous and often deadly path of prescription pills.
Even your family, people that you love, you'll go against just to get that high.
She says it took getting in trouble with the law for her to get help, or she could have gone to heroin, and admits she may have died. This 25-year-old recovering addict works every day to live a full life.
I'm currently on drug court right now as we speak. I finally got help that I needed. It's been just a constant battle for over 2 years now.
Emke was just one of many with a story to tell about the growing epidemic, who attended tonight's town hall meeting at North Park Theater in North Buffalo. As experts educated the crowd, paper lanterns sat on the stage, one for every person who died of an opiate-related overdose in Erie County last year.
We've already had more than 6 times the number of overdose deaths from opiates and opioids than we had for homicides in all of last year.
In fact, those numbers are expected to skyrocket as the drug war continues. But with so many people hooked on heroin and prescription pain pills, I asked Erie County Health Commissioner Dr. Gail Burstein if we have enough facilities and treatment centers for those who are suffering.
It's the demand, the need we have in our community for medication-assisted treatment for addiction and counseling for addiction far outweighs the supply of providers that we have in our community.
So what can we do right now immediately to help? It was recommended tonight that if you have any unused pain medication, maybe in your cabinet at home, you should bring that to a local police department. They do have drop-offs for those as well. It was also recommended tonight by the U.S. Attorney that everyone learn how to use Narcan and carry it as well.
And we keep seeing examples of how first responders are using Narcan to revive those folks who have overdosed.
Yeah, but is that antidote a double-edged sword? We spoke with Cheektowaga Police. They've responded to 57 overdoses so far this year, and some officers, including the police chief, fear Narcan's growing availability is only making things worse.
We are finding more and more cases where we go to a home or a vehicle where somebody's overdosed and there's a Narcan kit in there. We have several cases where people administered the Narcan themselves or somebody with them administered the Narcan. But I believe it's all tied together. It's a big problem with a lot of different causes.
To put that number in perspective, Cheektowaga Police only responded to 26 overdoses total in 2014.